Good morning, Kern County, and welcome to another episode of Kern Living. I'm excited today because we're talking about a topic that affects me, and it might affect you as well if you love McDonald's. Now, we're talking about weight management, and we're here with Omni Family Health, and we have Doctor. I'm going to let you introduce yourself.
Sure. I'm Dr. Muna Nathan, one of the family physicians here at Omni Family Health.
Okay, so now how does Omni help with weight management?
Weight management is really crucial to everything that we do, whether it's you're overweight, whether you're underweight. So we check weight every time the patient comes in to see us. We use weight as an indicator of the patient's health status. So sometimes if their weight is too high, it might relate to poor eating habits or other issues that could be causing the weight gain. If the weight is also too low, that can be an indicator of their health as well. So at Omni, we check their weights, we ask permission to talk to the patients about their weight, and not everyone's willing to talk about it every single time, but we give them the opportunity to bring this up to us whenever they feel ready, and so we have a process in place once they're ready to talk about it.
Okay, now I'm sure you also deal with patients every single day. Do you have a specific story that's maybe near and dear to you?
It's interesting that you ask. I have a patient that I saw last week. He's 14 years old. I saw him 6 months ago and he was pretty overweight for his age. We look at a graph and the graph tells us where a child should be based on their age and how much they weigh. So this patient was heavier than around 99% of people his age. So we also did some blood work and we noticed that some of his liver enzymes and other findings were a little bit high for his age. So we had a conversation, and it's a normal conversation that I usually have about eating healthy and exercising and cutting out on the junk food. So I had that conversation, and then I saw him recently, and he lost 40 pounds. At first, I thought it was a mistake, so I asked my medical assistant, hey, can you repeat that? And then when I spoke to him, he's like, no, I made changes. And so that doesn't happen too often, even though you want it to. But for him, I asked him, what made you make this change? And he said simply, I just wanted people to stop calling me names.
Okay.
Yeah. So I think it's really important to find, we can give you a million reasons to lose weight. We can tell you that, your blood pressure is going to get better, all this and this. But unless you find that personal reason that really matter to you, it's going to be hard to make that change. So I think that mindset is really important, and I think this one patient found the real reason that was really important to them, and it became easy to do what they needed to do.
Wow, a lifestyle change. That's what I need for myself, Kern County, because I love to eat junk food. And of course, I want to keep my weight managed to a healthy number. So thank you so much for coming on. If anybody was interested in learning more about Omni Family Health, do you all have a social media account?
Yeah, we have several social media outlets. So we have LinkedIn, we have Instagram, we have YouTube, and also we have Facebook too. So you can reach out to us on any of those.
That's awesome. Thank you so much for coming on and having this conversation with me. Make sure you follow us on social media at Kern Living and myself at Ryan Nelson 23, and I will see you all next time.